morning and welcome to the second day of the National Center for Primary Care's virtual summit, Accelerating Our Journey to Health Equity, Leveraging Primary Care, Innovation, and Leadership. Yesterday was such an amazing day. We focused on primary care, innovation, and equity. And our own NCPC Director, Dominic Mack, and Morehouse School of Medicine President, Valerie Montgomery Rice, kicked us off with a warm welcome. Then Dr. George Rust set the stage for the day with a compelling and inspiring opening keynote speech. We announced the release of our report with the Primary Care Collaborative, Primary Care, a key lever to advance health equity. And we're so grateful to Ann Greiner and the PCC team for their partnership on this report. We heard from Mr. Ben Money from the National Association of Community Health Centers and Dr. Cameron Matthews from City Block Health, who described some very promising and innovative models for primary care to address health inequities. But these speakers also highlighted some of the very real challenges facing primary care in the health system. Dr. Judith Steinberg shared how the U.S. Department of Health and Human Services is developing their strategy to strengthen primary care through payment transformation and innovation, with equity being a priority. And then we broke up into smaller groups and had 8 concurrent breakout sessions. These sessions provided a deeper dive into some of the partnerships and strategies of the National COVID-19 Resiliency Network to reach diverse communities with COVID-19 resources, information, and vaccinations. We had sessions that focused on the use of telemedicine by people with disabilities during the pandemic and how community health workers served as a critical resource for community engagement. And we also heard about technology solutions that primary care clinicians are using to ensure care coordination and continuity for patients. We ended the day with a moving closing keynote speech from Dr. Dana Bowen-Matthew, who clarified the many ways that structural racism is embedded in education, environmental injustice, and healthcare. And she made the case for primary care stakeholders to take action. You don't need to be a lawyer, you just need to act. We are carrying that momentum into today, where we will focus on leadership, policy, and action. In just a few moments, we will hear from Morehouse School of Medicine Dean Adrian Tyndall, who will kick off the day's events. Then we'll have a special session on the NCPC Faculty Development Program. As you heard yesterday, this program has been in place for more than 20 years and is one of our signature efforts that we've been making to empower and equip minority faculty to excel in academic and clinical settings. I am a proud graduate of the program, along with others that you'll hear from today, including Dr. Chanel McGoy, who will moderate our panel on leadership and equity, and Dr. Japare Hemming, who will lead one of the afternoon workshops focused on leveraging federal funds from the American Rescue Plan. And even Dr. Mack was in the inaugural class of the program. We will also have a panel discussion this afternoon with leaders from across the life sciences and health system sectors to talk about how they are embedding equity into their organizations. And we will hear from Mayor Dina Holiday Ingram, Mayor of the City of East Point, who will engage in a community dialogue with Dr. Monica Ponder about the incredible work happening at the local level to advance health equity. And finally, we'll close out the day with a keynote speech from Dr. Brian Smedley, renowned health equity scholar whose work has laid the foundation for advancing health equity at all levels. We hope that by the end of the day, you will feel compelled to take action. I will remind you of the questions that we posed to you yesterday for everyone in the audience to consider. Number 1, what is my role in the movement to achieve health equity? And number 2, what can I do today to advance health equity within my sphere of influence, regardless of what your title or position is? I want to just take a few minutes to again thank our sponsors, the United Health Foundation, the Dr. George Rust Endowed Research Fund, and the National COVID-19 Resiliency Network. And just a reminder to engage with each other using the chat function. And if you have questions for speakers, you can submit those via the Q&A function. And we are live tweeting again today. So you can follow NCPC_policy and use the hashtag Health Equity Journey on Twitter to follow and join the conversation. And you will find information and resources on the event website, ncpchealthequitysummit.com, And you will also use this website to join the workshop sessions this afternoon. Without further delay, let's get started. I am so pleased to introduce Morehouse School of Medicine Executive Vice President and Dean, Dr. Adrian Tyndall. Dr. Tyndall is an emergency medicine physician and exemplifies servant leadership. Dean Tyndall, we are so grateful to have you join us this morning and to get us ready for an amazing second day of our summit. Thank you.
Well, thank you very much, Megan, and good morning, everyone. It is so great to hear about this program, and to be very honest with you, I so wish that I were able to participate fully. The richness of the dialogue and the information that I understand has been exchanged, I think is just so significant. So this is day two, I think, of, again, a wonderful dialogue about achieving health equity through policy and through leadership. But I think what I'd like to do is to maybe provide to you, with you and talk with you about some of my perspectives, perhaps as an emergency physician, and really compel you to understand, or further compel you to understand, why what you're doing is so important. As Megan mentioned, I'm an emergency physician. I practiced in emergency departments, in inner city hospitals, academic health centers, in the private community settings, and in other spaces over the last 25 years. And there are things that I've learned about primary care, especially, and health equity through my experiences. And I think that providing some of those experiences and perspectives to you perhaps will lay the foundation for why I think this is such an important conversation. And then perhaps I want to spend a few minutes letting you know what the vision of Morehouse School of Medicine is, and what the next steps are as we think about how we continue to accelerate this march towards health equity. Now, first of all, as a practicing emergency physician, and yes, I do still practice, I have seen perhaps over my career several thousands of patients. I would say tens of thousands of patients. If I think about the number of hours I've worked and the patients I've seen every year over the decades, I've learned so much from those patients, both from their own perspectives on the healthcare delivery system and their lack of access. I've learned from them because of the outcomes that I've seen. Some of those outcomes ultimately devastating. But the key point here was that they were ultimately preventable. As an emergency department physician, I would say two things. One is that I care for any patient with any need at any point in time. But I will also tell you that 70% of those patients perhaps did not even need to come to the emergency department because they had an underlying condition that exacerbated to a point of requiring an emergency that ultimately would have been prevented if they had access to timely and effective primary care. So I think the question for all of you today is what are the policies? How can we ensure that our system can be structured or restructured to ensure that we can deliver the kind of care that ultimately would prevent this from happening? And I could go into the details of it. I could tell you that I have seen outcomes in asthma that should have been ultimately preventable. I've taken care of adults who've needlessly died because they didn't have access to primary care and the ability to control their asthma exacerbations. I've seen the devastation of stroke simply because someone could not have access or was not provided the timely and effective care to control their blood pressure that ultimately led to a costly and expensive and utterly significant problem not just for their health, but the impact on the family and so many others. I practiced emergency medicine during the first wave of the COVID pandemic, much less so during the second and third waves as I came on board Morehouse School of Medicine. I think at that point in time too, it was revealed to the world what inequities in our healthcare system, our primary care system, can actually result in. And I bore witness to that because ultimately it was important to me, even though I was a dean at that point in time, that I needed to engage in direct patient care because it's those policies, those very policies that help to organize our care and innovations around the care that we could provide that ultimately impacts those patients that I see, that I hold hands with, that I take care of every time I come into the emergency department. So I've learned a lot about what primary care, what innovations can actually do. I've also learned about what structural inequities in our systems can actually do and how they actually impact patients as I see them at the bedside. So I think the work that you're actually doing today is enormously important. And I believe that Morehouse School of Medicine is on the verge of continuing to deliver and, frankly speaking, accelerate the mission of advancing and creating and leading health equity in this country. One of the things that we have talked about a lot is innovations around technology and understanding that how technology can be onboarded to support and to improve the impact on health for individuals. How do we understand how communities can become much more involved in the process of delivering not just healthcare, but also health education? How do we ensure that payment policies are better aligned to ensure that they incentivize primary care over high-paid subspecialty care in many instances? How can we ensure that our system is ridden of structural inequities that result in problematic outcomes? These are the questions I know that you will grapple with and you will ask each other and hopefully come up with solutions. I'm proud of the fact that Morehouse School of Medicine is sponsoring this activity through the National Center for Primary Care. I'm proud of the fact that so many of you have come together to have this robust discussion around what we can do to impact patients. And moreover, I'm proud of our faculty and our staff and all of those who invest their day and their lives in leading and advancing the creation of health equity. I know that you're going to have an amazing meeting. I know you're going to have amazing conversations. I wish I could be part of it, but I know I'll hear about the outcomes. And my hope is that the solutions that are created here, or maybe the initiation of the creation of these solutions during these conversations, are solutions that we could actually integrate and implement and study and understand how we can best and better deliver healthcare to our community that supports equity. So I want to say thank you. Thank you for allowing me to say a few words. I want to thank our sponsors for all the work they've done and for contributing to this conference. I'd like to thank the speakers from yesterday because I understand how compelling they were in the words that they provided to you. And I know that today, throughout the day, that you're going to have great conversations and you will be developing terrific solutions for the work we have to do ahead. So again, thank you very much, and thank you for having me.